evening. Thank you so much for joining us this evening. As you know, we have experienced a case of monkeypox in our school system, and I felt it was critically important for our parents and staff to have an opportunity to hear from a well-respected medical expert. We believe in strong partnerships and transparent communication, and that's why every parent and staff member in our school system received email communication last night. If you didn't receive an email directly from the school system, please reach out to your child's school, administration, or teacher to ensure we have accurate contact information. The purpose for tonight's meeting is to share factual information regarding the monkeypox virus. Knowing more about the virus prepares us to address faulty narratives, misinformation, and rumors. Our goal is to ensure that you are informed. Over the next 45 minutes, we will hear from Dr. Arona and answer as many questions as possible. Speaking of questions, you will see at the bottom of your screen the Q&A area. If you have a question, just simply type it in the Q&A area. And when we get to that portion of tonight's webinar, we will do our very best to answer those questions. However, if we don't get to all of them, we will have them and work to prepare an FAQ document to share with our parents, our community, and our staff. At this time, I'd like to introduce Dr. Arona. Dr. Arona serves as the CEO and District Health Director for the Gwinnett, Newton, and Rockdale Health Districts. She obtained her Bachelor of Science at the University of California, San Diego, with a dual major in biochemistry and cellular biology. She graduated with her MD in 1991 from the University of Cincinnati College of Medicine and completed her OBGYN residency in 1995 from the University of Southern California. She is a member of and board certified with the American College of Obstetrics and Gynecology, and a member of and previous board member of the American Medical Association. Dr. Arona has practiced OBGYN in private practice for over 30 years, specializing in the diagnosis, treatment, and prevention of diseases and disorders affecting women of all ages. In addition, Dr. Arona has and continues to mentor and train physicians, residents, nurse practitioners, and other clinical staff. Dr. Arona served the Gwinnett, Newton, Rockdale Health Department as a physician consultant for 6 years, training and mentoring clinical staff and validating gynecological clinical care. Dr. Arona is a great partner, a great friend to the Newton County school system, and I am most grateful that she is here this evening to talk to us, to clarify and provide information regarding the monkeypox virus. Dr. Arona, I'll turn it over to you.
Thank you so much, Superintendent Fury, and welcome everyone. I'm so grateful to have been given this opportunity really to be with you tonight. I cannot imagine how much fear there is, how much chaos, how much worry, how much concern that you have. And my goal for tonight really is to help right size all of that fear so that we really understand, what is going on and, why you got these letters and what is the current risk and what is the actual risk. The most important thing is for us to share really factual information so that everyone doesn't respond to the fear of monkeypox, and for you all to really understand its transmission and how it is transmitted, which is really critical in understanding the part that the school plays and other places actually play in this too. So as you probably know, monkeypox is not a new virus. It's a virus that's been around for a very long time. I think the very first case was diagnosed in another country in 1970. So it's been a long, long time. It is a virus that is part of the orthopox virus, which includes smallpox. So it's very similar to that, although it's different. Monkeypox is not chickenpox. It's not related to chickenpox whatsoever. Pox, at the name of it, the POX, just means that it creates a blister-like rash, and that's all that means, really. But it is a very rare disease, and it's caused by an infection with the actual virus called monkeypox. And like I said, it's the same family of the orthopox or smallpox virus that causes that. So early in, or actually late in May is when the United States had its first case, and we started to see other countries start to have cases, and it spread. This is considered an outbreak. There are several countries that have had monkeypox this time that have never seen monkeypox before. So it is, an outbreak that's affecting, over 80 countries in the world right now. United States currently, as of last night, has over just under 16,000 cases. Georgia is 5th in the nation in terms of number of cases. And we currently have just a little bit over 1,200 cases in Georgia. And why is that? Why is Georgia there? Because, if you look at the major cities like Miami, New York, Chicago, Texas, Dallas, and Atlanta, Georgia, these are very populous areas where we have all kinds of populations and, big diverse populations. And so this is, also a lot of the areas where we have pride events and in different kind of events where people gather. And so, so that's a little bit of a background about monkeypox. So monkeypox is transmitted primarily through household contacts. So I really want to iterate, if you don't hear anything else from me tonight, I want you to know that we have not seen transmission in a school setting. We have not seen transmission in community. We've also not seen transmission in healthcare providers who are actually doing the test of these people who have monkeypox, right? So we have not even seen a healthcare provider get monkeypox from testing and examining somebody with monkeypox. So the primary mode of transmission is direct, prolonged, and that's really important that you understand that, prolonged skin-to-skin contact with somebody who has monkeypox. And it's actually the prolonged skin-to-skin contact of the actual lesion itself. So just, hugging somebody with monkeypox, or touching their arm, or playing on the playground, or, things like this is not going to give you monkeypox. You actually have to have prolonged skin-to-skin contact with the actual rash itself where the lesions are. The other mode of transmission where we're seeing this is through shared fabrics like towels or clothing or bed sheets, things like that, of somebody who has monkeypox, because again, the actual rash can seep into the clothing. And so if you have those shared types of clothing items or towels or something like that, we can also see transmission that way. It's really important for you to understand that the reason that the CDC had identified for schools the definition of close contact would be somebody who's within someone who's diagnosed with monkeypox for within 6 feet for at least 3 hours. And the reason that they use that definition is because there is a possible potential of a respiratory transmission, although we haven't seen that yet in monkeypox. So the CDC, of course, is being, completely thorough in giving out that precaution, which is why some of the parents in Newton County, when this case was identified, had the school system identified some close contacts, and that's the parents who received letters from this. But again, remember that is such a rare mode of transmission, and it's extremely unlikely. And again, throughout this whole outbreak so far, we have not seen any transmission of cases within a school setting. So it's really important that you understand that for sure. Most of the cases that we have seen are in adult males that have that prolonged skin-to-skin contact with monkeypox lesions. Okay, so yes, if you heard on the news tonight, I did say that we expected to see more cases in women and children. And the reason we expected that is because obviously there are households where monkeypox is going to exist in confirmed cases, where also females and other children live, right? And so we expected more cases, even though it's extremely, we've had less than 1% of all the cases in the United States have been involving women or children. And those are all of those have been linked to a household contact with somebody who has monkeypox. So, the important thing to know is that, yes, we expect women and children to, those numbers to increase as this outbreak increases and until we can get it under control. But that's because everyone who is in that household setting and is sharing towels or sleeping with or different things like that of somebody with monkeypox, even though you're female and even though you may be a child, you're still at risk of getting that from that person. But again, the primary mode of transmission is that direct skin-to-skin contact with somebody with confirmed monkeypox for a prolonged period of time. So as you can see, and I'm hoping I will do my best to answer all of your questions tonight about this, but it's really important that you understand that the risk at school is extremely low, even with that respiratory potential. As you well know, COVID was extremely transmissible through respiratory secretions. That's the primary mode that COVID was transmitted. Monkeypox is completely different and not at all related. In fact, that risk of respiratory transmission is extremely, extremely low. So again, we're just really trying to right size the fear associated with this. If you were one of those parents whose children were a direct contact of a case, or you receive some letter like that in the future, you do not need to remove your children from school. All we ask is that, you watch for symptoms, and basically you're looking for fever, lymph node swelling, kind of some prodromal symptoms, and a rash that will eventually occur if they were to be confirmed with monkeypox. And again, there are lots of reasons why somebody would get a rash, a lot of reasons, but just especially now, especially if you were a contact, of course, you would seek out advice from your healthcare provider and go forward to get, the appropriate testing and everything to make sure that they don't. But again, you do not need to remove your children from school. There is no need to jump to those conclusions. A reporter asked me today if we need to worry in the grocery stores and looking at people's skin and to see whether or not, are we supposed to watch out for people who have rashes on their bodies and different things like that. And again, the answer to that is all no, because the primary mode of transmission everybody really needs to understand is that prolonged skin-to-skin contact of the lesions. It's not just simply touching somebody's arm or brushing up against somebody. You're not going to get monkeypox that way. So hopefully I've answered a lot of your questions already, but I'm willing to, at this point, turn this over, Superintendent Fury, and see if anyone has questions. So we'll leave plenty of time to do that.
Thank you, Dr. Arona. And I just want to introduce some of the members of our team who are here this evening. Of course, Dr. Adam File, who is our Director of Technology and Media Services. He's sort of managing the webinar. Ms. Sherry Partee is our Director of Public Relations, and she's here and will moderate questions. And then Dr. Michael Barr is our Chief Operations Officer, and he really handles all of the operational pieces related to the notifications and things like that. And so with that being said, Sherry, if you want to take us through the questions.
Sure.
We've got 4 right now.
Sure thing. Dr. Arona, the first question we received said, wouldn't the spread of monkeypox be more based on international flights?
That's a really great question. I think that the way that it got to the United States to begin with is from somebody that obviously traveled to the United States, but the likelihood of you contracting monkeypox from even an airplane ride or even being in the same cabin as somebody is extremely rare. What we believe happened was people were traveling to different parts of the world for events, the pride events and different types of events where keep in mind that the primary population that has had this are adult men who have sex with men population. And so it's primarily the adult gay and bisexual community where this was initially spread and contracted. And so that's how it got into the United States and then transferred, from there. So again, the risk of you getting this from an airplane ride or from being in the same cabin as somebody or being in the same vicinity as somebody is extreme.
Okay, Dr. Arona, our next question, if there is a confirmed case at school and the child has the rash and the lesions pop and another child is exposed to the fluid inside the lesion, is there a high chance that child can get monkeypox?
Yes, yes, to answer your question, yes. But what we're asking is for people who have symptoms, we're isolating those patients. And what we're doing, and keep in mind that the location of that rash is really not usually in places where you would be exposed to that anyway. And so, but yes, I mean, I think it's basically a parental, parents should watch their kids and make sure that they don't have anything if they develop rashes or they have a family home situation, a household person who's had monkeypox. Again, the public health department is trying to vaccinate close contacts of people who have been confirmed positive for monkeypox. And so again, those people are, under close surveillance, the contacts are, and so yes, potentially that could happen, but the likelihood of that happening is extremely rare, given the likelihood of that person having been already diagnosed.
Thank you. Dr. Arona, our next question, if your child has an immune deficiency, will they have a different recovery?
That's a great question. And, the recovery, I would have to, consult the CDC to see if their recovery would be different. But I can tell you that just being immunocompromised would not increase your risk of getting monkeypox from a person, especially at school. Again, it's that prolonged skin to skin close contact with that monkeypox lesions that is going to predispose you. And then, but being immunocompromised, obviously, you handle infections differently. And so I would have to check to with the CDC to see, but it makes sense that the recovery would be maybe a little bit longer or a little bit more challenging. But again, we've got treatment for monkeypox, even in children. It's available under emergency use authorization now at any age younger than 18. And so, of course, your provider, your doctors who know your children well and would understand any present immunodeficiency condition that your child has would most likely put you on medication to prevent some severe sequela of it anyway.
Thank you. Our next question, how long can the virus remain on surfaces?
That's a really good question. And the answer to that, I looked that up today just to be certain. And, I saw as much as 21 days for things to, for that. But again, remember that at the school setting, there's constant disinfection and cleaning. The good news about this, and if you'll recall from COVID, it took a specific type of cleaner really to get rid of COVID. But monkeypox is it's not a very hardy virus. And so even UV light from the sun destroys the virus. And also our normal household cleaning products can easily destroy the virus. And so I know that the school systems are cleaning because of COVID anyway. And so I'm not concerned about, the surfaces at school settings in that case, but especially for families who have household contacts that have cases of monkeypox, those people need to be isolated, of course, and make sure that we don't share towels and fabrics and linens and clothing and that type of thing, and to routinely clean like anything. Most viruses are handled by cleaning products that we use every day.
Okay. Our next question, in regards to close contact with fabrics, if diagnosed, how should those fabrics be handled?
Great question. So just simple washing clothing and towels and linens. They don't have to be washed in anything different than normal. Just hot water and soap will eliminate the virus.
Okay. The children are sitting at their desk for prolonged periods of time. Is the virus transmissible from another child touching the same desk?
Well, again, the primary mode of transmission is skin to skin, prolonged skin to skin with that virus. So with the monkeypox lesions, actually. And so you can, if someone were to, squeeze one of the lesions or so and get that fluid on a desk, could you pick it up from that desk? Yes. But again, it wouldn't be 100%. From that because it's not prolonged exposure. And again, that's really unlikely to happen because usually if you have lesions on your arms or something like that, you wouldn't be at school anyway.
Right. Our next question. So should we leave our children in the school?
Yes. Now, the only reason that children need to be removed from school is if they have symptoms that are consistent with a monkeypox rash or fever, that type of thing. I mean, again, with COVID, we're trying to be really careful. If you don't feel well, stay home anyway, to be sure. But yes, if you have received a letter from the school system saying that your child is a contact to a case of monkeypox that's been confirmed, you can just follow those directions, which are very specific as about what to look for and things that you can do and what to look for, obviously. And if your child has none of those symptoms, please send your children back to school because there's no reason to keep them away from school.
Okay. Question, are physicians who are testing reporting the symptoms to the school board and the Department of Health? And is this a requirement?
Great question. First of all, it is a reportable disease to the health department. And so any physician who tests a person for monkeypox, once they get a confirmed positive test, it is a mandated reportable to the health department. I don't believe it is reportable to the school system. I'll revert to the superintendent for that, but I'm sure that the requirement is not that they report it to the school system, but I can tell you that they are automatically placed on isolation once the health department is notified, so that the risk of transmission in the school setting would not be possible.
Okay. Question, how long until a positive child with monkeypox can return back to school?
That's a great question. So the same is true for anyone with monkeypox. Essentially, what we ask is that, and in fact, we mandate and we follow them at the health department. We follow all of our positive cases, and we also follow the people who have been direct contacts, meaning a household contact of somebody confirmed for monkeypox. And essentially, what we do is the person who has monkeypox has to stay in isolation until those lesions completely heal over and scab. And when the scabs then fall off, and there's also new skin healing over top, then they are released from isolation. And the health department follows these patients on a daily basis, and does not release them from isolation until we have evidence that they are completely clean of lesions.
Okay. Believe I have a parent who has asked, does monkeypox consist of watery and puffy eyes, or could that just be allergies?
Yeah, watery puffy eyes are more consistent with allergies than they are with monkeypox. Typically what we'll see is that's actually more consistent with COVID than it is with monkeypox too. So I would definitely do a COVID test and make sure of that. But yeah, monkeypox does not really come from, or present with the puffy eyes unless they have lesions that are around the eyes.
Okay. What are the common places that the rash shows up?
That is a really good question. And most of the lesions are in the genital areas that have to do with this close skin to skin sexual contact. So most of the lesions, it's not unheard of to have them in other places, but most of the monkeypox lesions that we are seeing are in the genital area, anal area, some of the oral areas as well, that have to do with sexual activity.
Okay. Question: at what point is someone with monkeypox most contagious? The beginning with onset of fever to the expected end of the viral infection?
Right. The most contagious part are the actual lesions themselves, where you have the pustule lesions, and it's that direct skin to skin contact with the lesions. That's the most infectious period of time.
Okay. Is there concern over sharing chairs and spots on the rugs, etc., that may have touched a child's sores?
Again, that's not the major transmission route. Again, if you were to touch somebody's arm that has a monkeypox lesion, you're really unlikely to acquire monkeypox infection. Chairs are usually, people are sitting on, with clothing and different things. And so it's a really unlikely mode of transmission to get it from surfaces. We get that question a lot. Sorry about my dogs. We get that question a lot from the, questions about the pools and sharing of, outside of pool furniture and different things. And remember that the UV light and the lighting from even classroom lights will denature this virus. It's not, like I said, a very hardy virus at all.
Okay. Person asked, how many cases have been confirmed in Newton County?
All right, so I know that that's a question everyone wants to know. I can tell you that we are not releasing county-wide data. So I can't tell you exactly how many in Newton County, but I can tell you in our district, which is Gwinnett, Newton, and Rockdale counties, we have less than 100 cases total. And I can tell you that the far majority of those are in Gwinnett County.
Okay. Person asked if this is airborne.
Okay, so airborne means that it's more respiratory related. So if somebody's talking and the virus gets into the air, and remember I was saying that, that's why the CDC has listed contacts as somebody being within 6 feet of a confirmed case for at least 3 hours. Okay. But again, that respiratory component is extremely a rare form of transmission. That's not the primary form of transmission, and we haven't seen that really yet. I can tell you that the cases where we believe were respiratory related are from patients who have lesions in their oral cavity, and monkeypox lesions within their oral cavity, where there's prolonged contact with respiratory secretions, like in kissing and different things like that.
Okay. If we have special needs children with needs that require regular close contact throughout the day with teachers and therapists and doctors, is there anything additional we can do to help prevent exposure to the virus?
Again, the mode of transmission is that close skin to skin contact. And, I think at this point, everyone is so concerned. I would hope that teachers who are in a high risk population would be very, very careful to make sure that they don't have monkeypox lesions where they would expose children like that. So again, it's that direct skin to skin contact of monkeypox lesions. So even caring for a special needs child, it would be extremely rare for that child to obtain a monkeypox infection from a provider.
Dr. Arona, what is the definition of prolonged contact?
Yeah, that's a good question. And it's not defined. But I think we all know the difference between a sexual encounter that's prolonged, where you've got skin to skin touching, as opposed to, putting your arm around somebody and walking in the playground, or, brushing by somebody in a grocery store. So again, that's not clearly defined in CDC, and I hate that that's not clearly defined. But again, I think we just need to look at this as as more of a prolonged skin to skin sexual encounter is a better way to describe that.
Okay. Have a similar question. I believe you touched on it. The person asked, does the monkeypox virus live in surfaces? And if so, how long?
Right. Well, like I said, I've looked at the reports and they say up to 21 days. But again, it's that common surface cleaning that takes place especially in school situations. And if a family has a household contact of monkeypox, one of the primary recommendations we give to them is to clean those surfaces routinely and often. And so again, those mild household cleaning products are going to denature this virus.
Okay. Do you see the virus getting to the point of closing down schools?
Great question. And I do not see that as a necessity, nor do I see that as really happening here, but primarily because we have not seen transmission within school. If again, you look at the reality of how this virus is transmitted, and it's that prolonged skin to skin contact of lesions, monkeypox lesions, that situation is just not going to occur in a school setting. It's not going to. And keep in mind, remember too, from what I said at the very beginning, that even our healthcare providers who are testing monkeypox patients, we have not seen a healthcare provider transmission yet. We have not seen it in the general community, and we're not likely to see it in a school setting either. And so for that reason, I can't imagine that we would ever need to close down schools for this. If you think about it, the way that schools are set up, kids are safer at school than they are at home if they live in a home where this potential could exist. So the other thing is I do expect that this, like a lot of public health responses to outbreaks like this is going to be self-limiting. This will go away. As soon as we can get, more and more people every day are getting vaccinated for this. And by the way, I should say too that we are not vaccinating contacts from a school situation like this. So if you were a parent who received, a letter from the school saying that your child has been a contact of somebody, we are not vaccinating your child, nor would we recommend that right now, because again, the risk of transmission is so low. Who we are vaccinating right now are household contacts of people who have confirmed monkeypox infections. We're also vaccinating high-risk populations, men who have sex with men, or if people have been at an event where a monkeypox outbreak, or somebody with monkeypox has been there and there's been, sexual activity and close contact with people at these events. So we're vaccinating those special populations, right now. But again, the likelihood of school closures due to this is pretty far out.
Okay. Question, as monkeypox continues to spread, do you expect the pattern of transmission to change? The person said they read a demographic breakdown that in some parts of Africa, it's now 60% male and 40% female.
Right. So if we think about what I've already said about the transmission, right? Again, if you understand the primary mode of transmission being prolonged, skin to skin contact and the sharing of linens and towels and things like that. So the more people that have monkeypox in homes are going to expose the other people that live in those homes as well. So I think what we're seeing in Africa and other parts where there's more women involved in that is that we're seeing that gay and bisexual population that now involves women who are also involved in that activity, or they're exposed to the bisexual population. And so you're going to see that transmission there. So again, the whole key about, a type of outbreak like this is to try to diminish transmission as much as we can by isolating people and also promoting education about how this is spread so that we can diminish that transmission and then also vaccinate as many people at high risk as we can.
Okay. Viewer asks, I heard symptoms show 3 to 5 days before blisters. Is this true?
I think that, and I'll have to review just to see exactly. I don't know exactly how many days before, but again, that's why we ask parents and people who are at risk or think they have been exposed to watch for a rash for 21 days, right? If you receive that letter, you'll see. So typically, I think you would see the rash begin sooner than that, but it's also possible that you won't see that rash for up to even 3 weeks later. So again, it's a continuum of time where after exposure, usually you'll get the rash sooner than that, but it could start as soon as 3 days, but it could even last, may not pop up until 21 days later. So that's why you've got that large range, and it's terrifying, really, to have to watch for those symptoms for that period of time. I know.
Sure. Okay. How quickly could the virus spread throughout the schools or to another school in the system?
Well, again, we have not seen transmission in the schools. Okay. Again, the people that we're identifying who happen to be children that go to a particular school, we believe, in fact, all of those cases so far have been linked to a household contact. Okay. So again, every woman and child in the United States that we have seen with confirmed monkeypox has been linked to a household contact. So again, the transmission at school is not thought to occur. We haven't even seen that yet. And so that's one of the most important things about tonight's meeting, is that people really understand that the school in and of itself is not a risk factor for monkeypox.
Okay. Viewer asks, can you contract monkeypox multiple times?
The answer to that is no, we don't believe so. Once you contract monkeypox, then you're immune for it, immune to it for forever. And that's what we believe is true of monkeypox to this day.
Okay. Viewer asks, how do you know if it's the onset of monkeypox?
Again, I think, you know, the confirmed cases that we have in the households, right, put at risk, you know, when we identify contacts in the home, those are the ones that we're most concerned about. And so I'm not sure I'm answering your question, but the likelihood of somebody just in the community that doesn't have a risk factor at home for that is extremely rare. So again, monkeypox is a concern for people who have a home situation where either you know, somebody in your home lives that's in a high risk population, or you know, that type of thing. So the risk factor in the general population that doesn't have that risk factor isn't any greater than anyone else.
Okay. Person asks, for fabrics that aren't possible to wash in a machine, such as a couch or a mattress, is a sprayable disinfectant sufficient to eliminate the virus?
Yes. Yes.
Okay. Let's see.
And again, that's part of the recommendation that we give to household contacts for people who live in a home where there's been a positive case or, you know, confirmed positive exposure.
Person asks, can your dog get it and transmit it to others?
That's a great question. We have not seen animal transmission yet. And so, I guess we'll just wait on that to see if anything were to pop up, but we have not seen that transmission in the United States.
Okay. For safety, would it be wise to wear masks while in school?
I think the risk of COVID is much higher than the risk of monkeypox. And I know there's a lot of concern about wearing masks in school for COVID. So I certainly would not recommend a universal mask mandate for monkeypox. Absolutely not.
Okay. And Dr. Arona, we've gotten a lot of questions that I think Dr. Barr would be able to answer if he's there. We're getting a lot of questions about cleaning and disinfecting at the schools, how often, how buses, are they being disinfected? So if Dr. Barr could come on and maybe speak about that.
Hey there. Good evening, everyone. Thank you. First of all, thank you, Ms. Fury and Dr. Arona, for making this session available for our parents and staff. I think it's been very helpful for everybody to hear the opportunity to hear this information this evening. The CDC recommends following everyday operational cleaning protocols aimed at reducing the transmission of infectious diseases. And so we as a school system continue to use those processes in our school every day. The processes include such things as the cleaning of high-touch surfaces and the use of EPA registered disinfectants according to the manufacturer's instructions. We are certainly, I also want to say that I'm proud of the work that our teams are doing to make sure that our learning environments are clean and safe for our students and also our school buses. And so that's the kind of work that we're doing, but it is everyday operational cleaning protocols that we're using, and that's recommended by the CDC. So hopefully that will answer many of the questions that have been asked there, Sherry.
Yeah, okay.
With that being said, thank you, Dr. Barr and Dr. Arona. It is about almost 7:45, and we definitely wanted to make sure that our parents and community were well informed about monkeypox. I think the not knowing is sometimes the scariest part of having to deal with situations like this. And we've not had to deal with monkeypox before, but with the support of the Gwinnett Newton Rockdale health department and other medical partners, as well as the operations team in our school system. We're doing everything that we can to ensure the health and safety and well-being of our students and our staff. And we do have some questions here that we will probably just put into an FAQ because they're not really related to the medical side, which was the purpose for tonight's meeting. I think there was so much misinformation and rumors circulating. Parents of Newton County school system students, as I have said previously, and I will continue to say, when it comes to medical concerns and health impacts, I will always defer to the medical experts and follow the recommendations that they provide to us. The other thing that I will always do is be honest and transparent. I'm not going to keep information from you. If I know it, I'm going to share it with you. I think that is strong partnership between our parents and our school system that really helps us keep students in school and protect them while they are in school. We will do everything that we possibly can because we know that when students are not in school, we've seen it through the COVID crisis that we've experienced since March of 2020, that our kids academically suffer, and we've actually seen some impacts of their social interaction between and among our students. And so we want to do everything that we can to keep our kids in school. However, we will not do such a thing if it were to cause a health problem for any of our children. So parents, we're going to comb through the questions that we have available to us and try to create a document that we can post on our website to share question and answer information like, will there, if there's an outbreak in the system, will you know? Of course you will know. We will not keep that information from you. And then what happens from that point? And I think given the March 2020 to where we are now, the end of August 2022, we've got a lot of experience about pivoting and changing things if necessary. But I feel really confident that the health department and Dr. Arona will be able to help guide us through and help us make decisions that keep for us the primary focus on maintaining the health, safety, and well-being of our students and staff. So with that being said, Dr. Arona, thank you so much for taking time out of your evening to share with us information about monkeypox to help educate our community, our parents, and our staff members so that we can also share with people who may not have the same information and maybe perpetuating misinformation unintentionally or intentionally. We're armed with more information after hearing your presentation. So thank you so very much.
You are so welcome. And I really applaud the Newton County public school system and you for doing this because it was definitely necessary. And like I said, our major goal is really to right size all the fear out there, really get facts to people so that there really is not this sense of fear that you have to remove your children from school, which is just, not necessary at this time.
Yes. And again, thank you, parents. Thank you, staff members who have joined us this evening. We are grateful that you took time to spend with us learning about monkeypox. Unfortunately, we're having to learn about monkeypox, but I feel that the information you've been provided tonight will help ease your fears. And if you have questions or concerns, please just do not hesitate to reach out to us and look for that FAQ in the next couple of days. Thank you, everybody, and have a great night.